welcome to our 1:30 bite-sized talk. If you're here, come on in, sit down, come join us. We are going to kick off. For the next few minutes, we are going to talk about how CMS is changing the game and impacting the reporting that we're doing with all of the healthcare industry. So really the objective for today is to talk with Charles Spence here, one of our Cigna Medicare Advantage folks that joined us this week, to review the complexities of the updates that CMS is doing, their direct impact on how our community is going to be handling that, and then work to gain some practical insights and align on how these standards are going to enhance both our compliance and our quality. I have done a lot of shows with folks and panel discussions, and I think we all are thinking about this a lot, right? So this is a great topic to be discussing. We're going to move through this from an interoperability, navigating change. We're going to talk about managing the data a little bit, and then what that impact looks like. For anybody that knows me, I talk really fast, so I'm going to turn interoperability into interop while we're here together. So what is interoperability? I think anybody that's at this conference knows that it has been around for a long time. I heard somebody say AI yesterday has been around for 50 years. FHIR has actually been around since 2014, if not farther back, probably more from a use case perspective. And what I really want to talk about is how all of these things connect to each other, why they're important, where they come from. And I will be very clear, this is not the only thing that we're working towards that we're going to have to work with from a systems perspective, but these are some of the bigger buckets of things that are helping us and impacting us from a CMS perspective this year, right? Arcadia thinks about interoperability all the time, API. You guys, if you've joined us here at the booth or any of our discussions, we've been talking a lot about AI. So our data gateway is the way we are supporting our client partners and anybody else that comes to join us and how we are going to do our connectivity suite. So we have what we call, and you'll see our Arcadia Data Lake, and it really is just where our integrations and our network connectivity pieces kind of filter into so we can make sure all of that is aggregated and put together. So let's let Charles talk for a minute now that I've had my intro moment. And let's talk about navigating change. Charles, thank you again for joining. I know that we have talked a lot about what this is going to look like, how this is impacting you all from a payer perspective, and all of the different intricacies that are taking place, right? So could we talk for a minute and what your thoughts are and what are these key elements that you guys have and you're leaning into, how your reporting may be looking, and I think folks would love to hear maybe your approach and what that looks like, even if it's from start to middle to end, high-level overview. I'd love to hear from you.
Yeah, absolutely. I think as you start looking about, the use case and what's propelling us forward, it's really about getting the data to the customer or your beneficiary at point of time. So it's their data. How do you get them the information they need for their care management, et cetera? Right. And also, how do you share on that journey of care coordination with other plans or other providers? So I think generally it's a great thing. It's just, it's a lot more complicated than just saying, hey, go out and get interoperability stood up. It's about how do you do it and how do you effectuate it. So it's not just something that's there, it's a shiny object, but it's something that can be used. It's no good to make it available via an API if you haven't built it into some type of workflow, right? You still have all these things, providers and plans are making it available, but if you can't integrate it into their respective EMR or their platform, what good does it do? It's just sitting out there. Right. So a lot of it is about making sure you understand what all that data is. Coming from a health plan, we have so much data, claim data, different type of medical data. How do you get all that abstracted to be something of use and meaningful? Because anything in the walls of your plan, you're responsible for and obligated under CMS guidance to start making it available for everybody. So I think for us, it's really about a journey because a lot of it is a moving target. A lot of these guidelines are still being defined and refined. Just recently, the final rule came out for the prior authorizations. So it's like you're building to a design that had just recently got finalized, but you had to start a while ago, right? So you're changing the tires on a moving vehicle. So, but directionally where they're going, which is a good thing. So I think that's where we're trying to figure out how do you do things from provider directory, payer-to-payer access, patient access, so they get all their claims and administrative data, and present all that stuff so you can consume it, but then also start tracking utilization and figure a better way to make it be consumable by your end users or customers. So so I think for us, the biggest thing is, how do you get all this data in, how do you aggregate it, and how do you service it up so it's of use, right?
No, I actually agree. I was looking at something the other day, and I think the US CDI is changing, right? The version 3 has like 90 plus elements, where it's almost double. If you guys have seen that, how many we're doing now. And one of the things that we're managing, to your point about the wheels on the bus, is we all just got used to the 52 or whatever is in there right in the moment. So how do we continue to make progress and change as we have these things shift on us, right? I will touch base. I know this isn't a you topic, so I won't make you talk about this, but also from like CQM reporting, when we think about quality reporting, right? We just, what was that, October, November? They came out and said, let's do Medicare CQM instead of launching that like full CQM platform. And so how do organizations quickly pivot and work towards the capability of doing that instead? So you talked about this a little bit, but let me make sure I didn't miss any key points for you, Charles. How are payers, we talk a lot about providers, and we want to support providers, right? We want to make sure that they're able to get in and do their day-to-day so that patients taken care of. If I'm just thinking very payer-focused, how are you thinking about this? And I know we talked about data integrations, but maybe we focus a little bit on timelines, and I would love to talk about the payer platform opportunities too.
Yeah, I think, from a payer perspective, the holy grail is how do you get all the information you have to the payer so they can help make an informed decision at point of care. That's the challenge, right? How do you get that interoperability? Because every payer is on a different EMR.
Yeah.
The payers also have different type of EMRs or population health platforms, so how do you connect them?
Yeah.
So from a payer perspective, it's how do you cross that last mile? You have all the data, how do you get it from here to there? So it's not just a few weeks later or a day later. You really need it at point of care. So that's sort of the path that everybody's trying to solve for, regardless of what plan you are. So how do you cross that last mile to get the data to that provider so they can take care of that member that you're servicing and providing for? So that's the piece and journey that everybody's going after and trying to solve for it, whether it's, we use Arcadia at Cigna, but how do you also then get all these different disparate platforms across the board, either into the platforms you have or consuming other data that you have available through the APIs, through the interoperability protocols, et cetera. So I think that's the biggest thing that we have, because our perspective is how do you take care of the customer and get them what they need. And with all the disparate technologies out there, it's too hard. If it's hard for a plan, you imagine it if you're a customer, right? You just want your data, you just want to get the best quality care. So that's our job, to try and figure out how do we do that, working with providers.
Yeah.
Right?
I will add, we were listening to a talk earlier, and once the providers are able to get the data integrated, or they send it to Arcadia, what does that look like, right? And so then you're dealing with another level of understanding how that integrates. Sometimes it's new, but then we add these API and FHIR interoperability pieces to it, and it just adds out a whole nother level of that dynamic where people are trying to learn to get this integration going a lot more smoothly and efficient. Mm-hmm. All right, let's talk about the impact. So what's this look like, right, over the next couple of years? Let's start with plans. Let's start with payers.
So I think if you look at interoperability, now with the final rules sort of coming to close, and we know what the ground rules are to work towards, and prior auth and all the requirements around that coming on, you're going to start seeing a lot of plans start focusing on, now, okay, I got the guidelines, how do I start integrating that into my entire prior auth ecosystem? And it's not just the prior auth and the UM piece, but to the provider portals. How do you extend that to the digital experience there? How do you extend it to the member digital experience from the member portals?
Right.
And that cohesiveness between, anything that plans are using different third parties to help drive utilization reviews, et cetera. So all those things have to happen very seamlessly in a timely manner. I think, as you start looking at the impact, it should open up a lot more transparency and efficiency by getting a lot of that friction out of the mix. Because right now there's too many hops along the way. And healthcare, I think everybody thinks of healthcare maybe as like a banking system where it's like you debit card and transactions done and you're done. They don't realize a lot of the things behind the wheel are still batch, file processing, and et cetera. So what these interoperability rules are really doing is driving data to the point of need at point of consumption, right? Not a week later, 24 hours later, but really at the point of care being initiated. So I think that's the good thing, and that's the impact. So as a customer and beneficiary, or somebody, one of us, I'm in the Medicare space, if my parents or my grandparents, you don't have to worry about them getting the right care, right? They're getting it, they're getting the decisions made in a timely manner and more accelerated. And so that's the impact. It's all good side there. And from a health plan, it's more efficient use of their resources. How do you get doctors and nurses doing what they're supposed to do, which is focusing on care?
And being able to focus on care, right? Like, I would offer, for the healthcare industry has seen so much change, let's say always, but let's say in the last 20 years, with technology being able to do so much more than it has. And it seems to speed up in my opinion, maybe I'm getting old, every year. So I also am just quite impressed by the provider organizations that are able to pick up and do new things. They give us good ideas all the time about being able to make things more efficient. So we really appreciate them. We also have to think about how much that impacts their workflow, because really, we all agree, at the end of the day, it's about the patient and making sure all of those folks are getting the care that they need, right? Everybody. And I'll add one last piece, the social determinants pieces that are coming in, right? There's going to be populations that need our help more and more, and we're going to have to be able to get that data to them. And right now, it's not, I see a lot of shaking heads, so it's not clean, right? It's very hard to get to that data sometimes if you're just looking for it in raw data. So, okay, any final thoughts from a healthcare industry perspective?
I think interoperability really gets us to what we want to be, the art of the possible. How do we make care really personable, right? And the only way to do that is to drive it through insights and data. So I think interoperability and a lot of things that come with platforms like Arcadia really get you there, and that's what we want from a plan perspective, right? And I see only that's going to be driving in a lot more accelerated manner going forward, because data is a heartbeat of everything we do, from decision support to insights, to cost management, to quality management. So I think it's only going to continue to accelerate as we go forward.
I completely agree. Charles, thank you. This is super, super impactful.